I have been hearing people talk about exposure, and you mentioned it a little bit in your previous answer, but can you help us understand what you mean by exposure to
Yeah.
anything while pregnant?
Yeah. So people are exposed to things every day. You're walking around and there's smoke in the air, you're exposed to that. There's chemicals in the atmosphere, you're exposed to that. Food, medications, we're all exposed to things all of the time. What we worry the most about with exposure is prolonged and high dose exposure of most things. So examples that I'll often give someone, we screen for lead in pregnancy. We screen to make sure that someone doesn't have high lead levels because that can impact the development of their baby. So lead levels are high in people who have continuous everyday exposure to lead. If you visit a friend's home and you take a drink of water and they have lots of lead in their pipes, your lead levels aren't going to bump up. You're not going to have any negative impacts from a pregnancy standpoint. If you live in a home with lots of lead, you may. That is a long-term exposure. And things like acetaminophen or other meds that you're using for short periods of time are extremely unlikely to cause significant long-term harm because almost all long-term harms that are ultimately linked to an exposure are high dose long-term exposures, not occasional, a couple times during a pregnancy you needed to take a certain medication for a very specific reason.